I need your left hand.
All right.
Ah, my goodness gracious. I'm actually looking off at the blood.
Wow.
And it is
Oh my.
moving fast. You have a lot of energy this morning. I'm going to try to find a spot there. It's starting to slow down just a little bit, a little closer to the edge. Now as I flip over to dark field.
Oh boy.
That
What?
That white blood cell is actually very healthy.
Dr. Colby, thank you so much for coming by.
Thank you for having me.
I saw you about a week ago. We were at a GOL event, and you were one of the presenters, and you did a live blood reading.
I did.
For the space. And that was incredible on many different levels. Number one being, I never knew that was possible, and it looked like magic to me. So just before we even get into the blood and doing this here today, I just love to know a little bit more about you, your practice, and how you got into this.
Well, I actually need to go back about 10, 15 years. I was pushed, some would say, into naturopathic medicine through one of my instructors for massage therapy. I needed a couple more hours so I could be certified in Pocatello before we had a state license. So I finished what I needed for massage therapy, and that last instructor said, you have enough background, why don't you go for naturopathy? So I did that, did a lot of research, and started my program in 2005 with Westbrook University. In 2012, I graduated. It was a distance program, so it really taught me good research technique, which is what is really nice, to be able to say, hey, I'm not finding, where can I look?
Yeah.
And let's find the good sources online and not these pop-ups that say, I'm going to sell you all of this on copper, all of this on this, all of this on this other.
Yeah.
This is more, let's figure out what is working for you. And as we figure out what's working for you and what is true, good information, then I can share that with people. AI is going to be an interesting addition to practice as well, because I'm able to then take AI and say, hey, I've got this person, we want to work through the Cochrane reports. What do they need to effect change in their body?
Yeah.
And it will actually give then lists of supplements and minerals and vitamins and say, take this, take this, take this.
What a great merger of two platforms. Now, I've met quite a few naturopaths throughout my life, and especially here in the Treasure Valley, here in Idaho, there's an amazing community. I have never met anyone who does what you do, though.
I actually started learning live and dried blood assessment, appraisal, analysis, depending on where you are in the country, that allows you to call it one of those three things. Mm-hmm. I actually got into it in my externship with naturopathic health and naturopathic degree seeking. The naturopath I was working with does this with IV therapy, and what this taught me was what is going on in the blood. What you need is a very specialized microscope, and what we have here today is the second generation past when I graduated of the biomedics microscope. And it does look at the live and dried blood very, very specifically. And without going into what the different phase contrast technology is, what it basically does is it sends light through different prisms so that that reflected light hits the blood cell differently. So you can see on the live blood, if it's in phase 2, what's going on. Then if you change it over to dark field, then you can see some other aspects. Then as you look at the dried blood, you're able to see where conditions are in the blood, and it actually maps out. Well, down in the center is the gut and sexual organs. As we move outward, then it goes through the visceral organs into the surface organs, skin, and be able to say, hey, we've got some things going on. Oh, would you look at that? There seems to be an issue with your pituitary thyroid adrenal complex. I can't tell you from the blood if it's high or low. That comes from other testing.
Mm-hmm.
But that allows us to give us good questions
Yeah.
to start coming to the diagnosis that you will give me.
Interesting.
I'm not the one doing the diagnosing.
Wow. You're like an oracle or some fortune teller.
If you want to call me that,
Well,
okay.
it just seems it's like you're staring into the universe. It's fascinating, and just watching someone's blood outside of their body doing its thing, it really raises a lot of interesting questions. And I'm just curious, do you have like an affinity towards this work? Like, do you look at the blood and do you connect with that? Because obviously you must be passionate about that specific modality here, right?
Well, I am very passionate about it only because I've seen what good can come from that. And as I very simply will say, looking at the live blood is seeing all the creepy crawlies running around in your body right now today that this can pick up. And because it is only a capillary stick, so a little drop of blood that we're using, that only gives us a real tiny section of your entire body. And as we're looking at your entire body, I can say, there are some things we need to take a look at. That little capillary stick can show, there is some infection going on. I don't know if there is or not right now as we're talking here, but it can show, that there is evidence of some infection. Now let's look at this a little more in depth. And is this an infection that we need to be really concerned about, or is this something that is more in the past? And you're just getting over a cold, a flu, fungal infection.
Yeah. I'm just fascinated with the reading aspect. You're looking in there and you're reading it.
Yes.
And that's why I do feel like there is this interesting relationship.
There is some subjectivity to it, but not a whole lot, because as you're looking at it, you can see different things. But the way that some of the training is given, there are other practitioners that will look at it and see things that I don't, and things that I see they won't. And a lot of it is also a lot of the patients that I see on a daily basis, and I'm able to look at things and say, oh, that ring there is a heavy metal ring. You have been eating or drinking, specifically some coffees and where they're grown, heavy metals in your body.
Wow.
I don't know what heavy metals. I don't know. So that again, we need to do another test. Let's just look. And I am all about finding out what tests I can do, field tests that I can do that will give us better information without having you go down and spend hundreds or thousands of dollars for lab draws and we need to look at your testosterone. Oh, we need to look at your estrogen. Oh, let's look at, when I do a functional lab test, and you have a copy in front of you, that I generally will order a Chem 18, that is chemical 18 processes of the body, including glucose, A1C, the total thyroid complex, and then the CBC, or their complete blood count, because I want to see, is the blood at that day that you took that lab, is it fighting an infection?
Wow, yeah. I can't think of a better place to start if you are trying to understand a body, where it's at and what its needs are, and maybe learn more about the environment in which it's living. And it's fascinating, and I'm eager to dive in. So where do you want to start? Let me preface this real quick. I also met that same weekend. They were taking blood.
Yes.
At that event. And so Ageless Men's Health, I'm going to give them a quick shout out, because they took my blood on Saturday, and on Monday they gave me my results. And so that was the basis of at least the context that you know about me.
Yes.
Is that blood.
And that blood, as I always tell people, that lab work is a snapshot of the day that it was taken.
Yeah.
It probably is different this morning on the 6th of July rather than the end of June. So we're looking at things as they're always changing. And that's why I don't necessarily buy into, oh, I've got to get you this $300 lab test.
Right.
It's a good
Yeah.
place to start. If you have it and you have recent lab tests, yeah, I can take a look at it. I can plug it into the optimal diagnostic system or the ODX system so we can see where those lab results lie and what the optimal level should be for
Yeah.
you.
Okay.
And then that's a good starting point to say, yeah, now we can look at. By the way, in those lab reports, and because it was with the general men's health, your testosterone is fine.
Yeah, and I noticed that. What a relief. Yeah.
The estradiol is a little high, so there's a little bit.
All right. I need to know more about that. So where do we start? I'm in your hands now.
Well, the next thing is to actually do the live live and dry blood assessment, and to
Okay.
do that, I need your left hand.
All right.
And so as we do that, just to clean off this pinky,
All right.
and I always use the left pinky because in traditional Chinese medicine, this is the closest blood to the heart.
Wow.
So within that realm, this is the most energetic chi, electromagnetic energy, call it what you will.
Interesting.
But as we then pull that through, now are your hands often cold?
No,
No?
they're
Okay.
not.
They're a little cool this morning. That's why
Are
I
they?
have to ask.
I keep it cool in this office. I really do.
Oh, there's a little bit of anemia we're looking at today too.
Really?
Yes, the way that the blood wants to gather and roll off the finger.
Wow.
So we want to let that sit for about 20 seconds because what that will do is it will allow the blood to start coagulating, and that will form the rings then that I can look at and say, we're looking at this system and these organs and glands, and this is what this blood is telling us. And because it did run just a little bit, that's why I'm looking at it saying there is an evidence of anemia.
It's already talking to you.
It is. And I haven't even looked at it yet.
Interesting you mentioned the Chinese medicine and the energetic quality, the qi, because before you got here, I was doing breath work with some friends, and that's how we begin most days. I'm curious if that has any effect on what my blood is doing this morning.
It might. And then if we were in my office, I'd actually, you can wipe that finger off now. I would actually take a glucose test because, again, what we see with the blood and the glucose changes whenever we're after we eat, what we're doing that day. So the A1C, my goodness gracious, I'm actually looking off at the blood.
Wow.
And it is
Oh my.
moving fast. You have a lot of energy this morning.
I certainly do.
Now I'm actually going to look. We're actually trying to see,
Goodness.
because it is moving so fast, I'm going to try to find a spot there. It's starting to slow down just a little bit, a little closer to the edge.
Good grief. This is what I mean. I look at this and I am just moved. Like this is...
That is looking really good. There were a couple little dots in the background that could mean undigested pieces of protein,
Okay.
a bacteria, or other things that just aren't getting through the liver right yet. What I'm seeing, and as the blood is starting to slow down just a little bit, is for the most part, your blood is looking pretty good. The red blood cells, as you're watching them move around, are well shaped and it looks like they are getting enough oxygen. If there was a dot, you can see where it's a little convex, and that's where that little white dot is most of the time towards the bottom of the red blood cells. If that were dead center, like a target, we call those target cells, and that is an indication of anemia.
Wow.
So that's a secondary indication to say we should look at possibly B12 or iron. Being male, I would say more of the B12 than iron.
Okay.
Women of childbearing age, because they lose blood every month and lose iron sometimes, and especially right after the cycle, they need more iron.
Uh-huh.
And as we're looking now, if you look at the screen down toward the right-hand corner, there's a little circle that things are kind of rolling around.
Yeah.
That looks like a shadow.
Yes.
That is something that we call a ghost cell. That is an indication that you are probably fighting some candida or other fungus.
Wow. Can you
Now-
tell how severe that fight is, or it's just a
Not right now.
presence?
No, it's present is what I'm seeing, and
Wow, things are really slowing down.
they are starting to slow down, and that's where we can start some of those target cells, because you can see some of those white dots are now moving towards the center of that red blood cell.
Yeah.
And if we're seeing a bunch of that,
Okay.
that's where we're able to say, yeah, that is more of the target cell. And you can see almost center of the screen in that misshapen red blood cell as it's going up.
Yeah.
One that is a true target cell.
Right. Wow.
So there is a little bit of evidence of a anemia. Now I'm actually moving this closer to center. You see that red blood cell, and there's been a couple that have spikes.
Yes.
Those are actually, with the way that I put the slip cover on, is an indication that it got too much oxygen.
Oh, wow.
If I'm seeing an awful lot of those are red blood cells that have taken on immune effects of the white blood cells.
Oh.
So it's actually fighting an infection
Wow.
if there's
From
an
its-
awful lot of those.
Okay.
Most of the time it's operator error of what I'm seeing and not necessarily something that's going on bad. And as I'm talking my way through this and talking through this, and for those watching the podcast, I'm actually looking at the screen with the live blood on it, and not necessarily camera, but so that I'm looking at what you're seeing.
Mm-hmm.
What I'm looking for are neutrophils, eosinophils, and basophils. Those are white blood cells, and those actually do reflect, if there's a bunch of them, they reflect an infection of some kind. And if I don't, there's one. And if I don't see them, that's also a reflection that your body is not all as healthy as you think they were.
Mm-hmm.
Now that's one in the dead center.
Yeah.
That actually is a neutrophil. Now as I
Wow.
flip over to dark field,
Oh, boy.
that
What?
white blood cell is actually very healthy. It has eaten about 3 or 4 red blood cells,
I see that.
and those white dots all throughout that cell.
Mm-hmm.
If you look closely, they're shaking, and that is actually an indication that it is still very much alive. And what's really cool, as I'm working with my patients, and I have my monitor behind me, and I'll be explaining all of this, looking at the patient, the screen I leave up, and you can sometimes see that neutrophil wrap around a red blood cell
Oh, my.
and do its job. It's really, really cool.
That is so intriguing. And now here's what's interesting is I was really glad to have taken my blood on Saturday, because the previous blood test came back and it said I was unusually low in white blood cells. And I had kind of a little trepidation about coming back and learning more about that.
And I would say you are low in white blood cells.
Mm-hmm.
That's not something that I'm actually going to say, well, we need to fix that now.
Right.
This can change through dietetic changes and lifestyle changes just to try to get things working.
And that's one thing I want to understand, like why could it be low and how do you change that?
Some of that could be because we are in such an environment with so many electromagnetic fields.
Wow.
It actually is affecting our blood.
Mm-hmm.
And that could be something that, in your case, causing the white blood cells not to be as high as we need.
Yeah.
Now, as I stop here, oh goodness, one thing you're told in school never to say.
Yeah.
I say that because you can see there's 3 white blood cells. There's one in the dead center, that's a neutrophil.
Yeah.
Then off to the right-hand side, just slightly lower, there's another one. And then above that, you can see about 3 or 4 red blood cells, a little blob.
Yeah.
with a white spot, that is an eosinophil. That is what fights fungus and or virus. You want to stick your tongue out at me, put it back, you are fighting candida.
Really?
There's a white film on your tongue, and that tells me that there's a lot of candida that you are fighting.
Wow.
And so as we look at these, and you see the one in the center is, and you see as the blood is slowing down, but you see the one in the center is not quite as bright, so it's getting closer to the end of its life cycle.
Really?
The one to the right, almost center, is one that's very much alive. And then again, as you go up about 1, 2, 3 spots, and there's a kind of a mash on the upper right side.
Oh, yeah.
That's the eosinophil.
Wow.
And then as you look above the mass there's a bright dot that's just kind of floating by and going off screen now. That actually is could be undigested protein, bacteria. It's probably not virus because they're so small that even on this magnification, I just can't see them.
Really?
Yeah. Go back to phase 2, which gives us more of what we can see and talk about. And as I move the objectives around, it will actually come in and out of focus just a little bit. But as we're looking at this, this is why it's so much fun, and why I'm able to say, yeah, I'm seeing evidence of infection. With you, it's not as much of an infection, although the anemia that we've already said, there's probably some there. I'm seeing a little more of that. The eosinophils and the evidence of the candida, and I'm going to bring that eosinophil as close to center right there and up.
And I know people are going to ask about that larger mass with the rainbow edge. What is that all about? Is that some type of, like top left corner, for example? What is that strange?
Oh, the top left and the top right corners, those are just air bubbles.
Oh, excellent. Okay.
The center where you see kind of that glob of black, and there's some little gray around it, then that bright circle up to the top of that on the right hand side, that is actually the evidence of the yeast, the candida.
Wow.
And why then you have the ghost cells. In fact, the ghost cell just appeared just a little above that, and it wasn't there 3 seconds ago. What's amazing is as I'm talking and walking through this, you will suddenly see the ghost cell appear. As you'll just see a red blood cell going along, and all of a sudden it'll turn immediately into that ghost cell. And it's absolutely amazing, but you don't know when and you don't know where it might appear.
And but you're at any point, I mean, this is happening. You are.
Yes.
There is fungus. These cells are actively working.
Yes, and that's why I say this is the live appraisal assessment. You're looking at it and you're seeing what creepy crawlies are running around in your body right now. I just have a little bit of a better magnification through here, and there is a neutrophil close to center, and then to the right side there looks like a strand or a string coming out of a blood cell. It's not moving, so I can't call that a spirochete or the basis of Lyme disease.
Oh, wow.
I can say that could be a parasite, but if it is a parasite, it has done its dirty work and has died and is exiting the red blood cell.
Oh my goodness.
And some of those dots that we see shaking around could also be parasites, and I see those on people all the time.
Those little black dots that keep seeing moving about?
Yeah.
Oh, there's one,
As it's
bottom left, I see,
Yeah, those could be, and that's why I say I can't.
Look at the way it's searching.
Yep. And the way that is looking like it's searching causes me to think that probably is a parasite. Do I know what type? No. Do I really care? Not really. Should it be there? Oh, heavens no. Do we want to get rid of it? Yes. Can we? Yes. And there's different protocols that we do have that can help get rid of those things. And then, as I was saying earlier, we were looking at what looked like a lot of target cells. Those target cells have actually calmed down quite a bit. So I'm actually going to come back. There is a little bit of anemia, but I'm not going to say it's something that we need to be concerned about, that we need to address right now today,
Okay.
and give you a B12 shot, so to speak.
Oh.
But it's something that we're looking at more of where we need to go. Now, reason I pause here, all those little glows in the background,
Yeah.
those are the ghost cells. But as I get closer to the edge of your drop and oxygen gets to those cells, that's when they'll start popping a little more or frequently.
Okay.
And it's just interesting to look at. Now, as we come down, and this great big thing in the center there, that's actually an air bubble.
Okay.
So nothing to be worried about. Then up to your left is an active neutrophil. Up to the right, and then
Yeah.
up to the left
Oh, yeah.
is another one. And again, I love looking at it through the dark field, so you can see what's alive and really working, and the one to the right is really working hard. The one to the left
Yeah.
is almost done.
Yeah. So tell me more about the dark field. What are the differences between
The
those
dark
two
field,
modes?
with the phase contrast microscope, it's just taking the light from light source and reflecting it through basically a prism, so that you can see the different surface areas of the blood.
Okay.
And the dark field, the most simplistic way I can phrase it is if you ever are in the west side of the valley and you're looking up at the Boise front as sunset happens, and you're seeing every nook and cranny of the Boise front.
I love that.
That is like the dark field, because you're seeing every nook and cranny. And it's just a different, and what you don't see is, if we were to walk out of your studio right now and look at the front, you see this nice brownish, since the weather's getting warmer, of all that vegetation maturing, but you don't see the hills and where the creeks come down and the folds of the mountain.
That's that magic hour. That's why I love to be out there filming and taking photographs.
Yes, and that's where we're seeing the other details, and that's why the dark field can be very, very good. And you see, even as we're talking, more of those ghost cells appearing.
Yeah.
Even in the dark field. So it's always incredible to see that. And now it's been long enough that I'm going to go to the dried blood.
Which is so interesting, because initially when you said that you were going to do a live presentation with live blood and then dried blood, I thought there was going to be like, come back in a few days and I want to show you your dry blood. No.
No.
We're talking 10, 15 minutes.
Yep. That's all.
Wild. That is wild. And even in instances where you say, oh, maybe there's anemia here, maybe a B12 shot. B12, you said?
B12.
How fast do you see, like, I know these are snapshots of the moment. So how fast do you see the blood change after, say, a B12 shot?
I've had people actually stick a nicotine gum in their mouth, and I've taken another spot of blood, and you see it in the dried blood. Today's what was taken today, immediately.
That's wild.
It is absolutely wild.
There's a lot of exploration you could do there. I'm sure you've been doing that.
Yes, an incredible amount of exploration.
Yeah. Wow, look at that.
Now, as we're looking at your blood, this first drop is what's going on and happening in your body right now today.
Yeah. Wow. Dr. Colby, what is this telling you, man?
This is, and that's why I'm actually going through the...
I see, yeah.
This drop, what we're looking at on the left-hand side, where it's kind of... You can kind of see through it, that's what we call the vitamin ring. And right down here on the bottom portion of what you're seeing, the vitamin ring is looking pretty good. That is, you're absorbing the vitamins that you're getting through your food and any supplements that you happen to be taking. As we go into the blood drop, and you see the edge where it's a little lighter red, where looks like there's little bits of white spot.
Yeah.
That white spot is C-reactive protein. That is a sign of inflammation. Right around the edge is the surface of your skin. And that surface tells me that there is a little bit of inflammation, and where you looks like it almost like a couple sea waves.
Yeah.
That is telling me that your adrenal pituitary thyroid complex is a little out of place. And even in your lab work, it does say with the TSH as high as it is, the thyroid might be a little low.
Wow.
I can't tell you if it's primary, secondary, or tertiary hypothyroidism, but there might be because it is the TSH is a little high.
Okay.
Again, I could order those labs, but
Yeah.
let's figure out if this is something we need to do.
Yeah.
And as we go deeper into the center of the blood drop, come up this way. That is actually getting closer to the center, as we go towards the center of the blood, that is getting closer to your gut. The junctions in your gut are actually looking really good. And the junctions are those really long black lines that are in between each of the blood segments, so to speak. That is actually, those are looking really good. And I'm pleased with those. Again, as we get closer to the outside of your body, that's where we come up with that C-reactive protein, those white dots.
Okay.
And so that's something, you are fighting some inflammation. And now, this drop that we're looking at right here, it was all taken at the same time, and you saw it.
Mm-hmm.
And, this is representative of what's going on in your body right now today. We go to this next drop. This is your body about 2 weeks ago.
Oh, interesting.
The way that we're able to look at that, and as I put it on the slide,
Mm-hmm.
it looks at, and I don't know how it does this. This is part of the quantum mechanics, quantum physics. We don't have the answers for, but we're able to look at it and say, oh, a couple years ago, well, this is a couple weeks, but a couple years ago you had. And there have been a couple times I've been able to look at some blood drops, and you saw this at the...
I did.
That I was able to say, oh, you had some injury in your chest area several years ago for the young lady that I looked at.
Yeah.
She nodded and said, yes, I did. I have not seen her blood since. I have not seen that particular young lady since that moment in time. But she was able to say, yes, I did have. Do I know what happened? No, I wasn't doing the full-on 2-hour. This is what we're looking at.
So what is different then from that first
From this first sample
Yeah.
to this one, your vitamin ring right at the edge is looking really good. I am seeing there's still a little bit of C-reactive protein. The pituitary thyroid adrenal complex is not as inflamed. So we just got done with the 4th of July.
Mm-hmm.
We were probably all up watching the fireworks and watching all sorts of stuff all night long.
Mm-hmm.
Our thyroid and pituitary glands are going, what are you doing? Go to bed.
Yeah.
And so the adrenals were overfiring, and so because of that, that is supposed to look like an equilateral triangle.
Oh, really?
If one is overworking, it's going to throw all the other two out.
Mm-hmm.
And so that's part of what we're looking at. And
Okay.
there probably is, we're so overwhelmed with festivities of this weekend, this last weekend.
There's a lot
that the
going on.
body is just saying, oh, I need some more sleep. I need some more.
Yeah. I actually had one night, not last night, but the night before, where I almost didn't sleep at all. I was a restless night up until about 6:30 a.m. and then I got 3 hours of sleep.
Okay.
So
now, and I pulled this towards the middle, as you're looking at, it looks like there's a long line of white.
Mm-hmm.
That is an indication that there might be a allergy, environmental allergy.
Okay.
But again, we've had, a couple weeks ago, we had the major rainstorm and dropping all the pollen and all the stuff ended up in the streets.
Yeah.
And then again, this weekend, it could have been there, and could be all the sulfur that was in the air from all the fireworks.
Oh, good point. Yeah.
Is it something I need to be worried about? You need to be worried about?
So there's something to be said about consistency over time. Like, do you see a patient weekly sometimes, or how often do you check blood?
Well, when I check the blood, usually right at the beginning every 2 weeks.
Okay.
Because if I'm going to put you on a supplemental program, a program of supplements, I want you to be able to look at the blood, and it takes about 2 weeks for those supplements to really start being absorbed by the body.
Okay.
And I want to be able to say, yeah, now we're looking at this. Now, as we look at what's going on in the blood and those supplements and how they're working, then I can say, well, I don't need to see you now for another month or
Okay.
2 months or 3 months. And if I get you where you need to be health-wise, I don't want to see you more than 3 times a year
Incredible.
to do this.
Wow.
Because if you're where you need to be and everything is level,
Yeah. That's
you
a
can look
smart-
at it, but it's just money you're spending. That
Yeah. At that point, you're monitoring.
yeah. And I'd
Course
rather
corrected.
monitor than, oh, we're in an acute phase. We got to get,
Yeah.
oh, let's do. Yeah, okay, whatever.
Yeah. That's a very specific approach to health and wellness that needs to be embraced.
Yes. And
as opposed to, where is it?
yeah, well,
Find my problem.
and that's the thing. Your body, as we're getting to the root cause, your entire body holistically, WHO holistically, is fighting what's going on. And it's not necessarily fighting, is do I need to learn to live with this
Right.
as blood pressures go up, as blood sugars tend to go up as a society? Then we're looking at, well, what can we do to bring those down?
Yeah.
As we age, and this is something I will tell people as well, as we age, the vessel walls will start to get a little harder. As they get harder, just like that garden hose you leave out all summer long and is getting weathered, the pressure is going to start going up of the water going through that hose.
Right.
And that's just those the vessel walls getting harder and becoming the copper pipe, for
Yeah.
lack of a better term,
Yeah.
that the water's going through. So that pressure goes up. If it's astronomically high and it's not where it's normally at, then I might become concerned. If you're 45 and 50 and your blood pressure's at 130 over 80, I'm not real concerned. That's about where blood pressure would be considered about normal. A blood pressure of 120 over 80 is perfect for a 20-year-old that's sitting on his couch eating nothing but bonbons all day long.
Right. Yeah. Wow. It's nice hearing blood pressure framed in that way. That's very helpful, actually.
Now, if it's astronomically high, 160 over 100, then I'm starting to, what's going on? How's this happening? Is this more longer term? If it is more longer term, I don't like it that high, but if it's more longer term, your body's going to adjust to it.
I see.
If it's getting up to 190, 200, yeah, we're in trouble. I'm going to take you right now and we're going to go to the ER. This is outside of my purview, and you need to get that down now.
Some severity. Yeah.
And it's not just the cayenne pepper to help bring that down. It's get this down now.
Wow.
You're in an acute phase of something going on.
You're making me nervous right now. You don't check blood pressure, do you?
Didn't bring it with me, but
Okay.
normally what I do for the visit, I will check blood pressure on both wrists.
Oh.
Because that gives me another field test
Yeah.
of where the pituitary thyroid adrenal glands are.
More data. Incredible.
Absolutely.
So many tools at your disposal.
Absolutely. And then, as we were talking about, that second drop is what we're looking at right now. We go further, and your gut was a little more inflamed. So you probably a couple weeks ago, you're eating some stuff your body didn't really like.
Really?
A little bit of gas. I'm looking at that black that's around those that C-reactive protein, the white spots. And so I was like, oh, there's something that you ate that your body didn't like.
Well, shoot, man. I wish I was keeping a diary or a chart, because this has got to be so helpful for isolating dietary issues, things that don't agree.
Yes. And now as we go back, this is now looking back several years. You still are looking at things in the center, all that white stuff.
It's got to be the
And
sriracha.
the darker, that I don't know if it's sriracha or not.
Okay.
And actually, the sriracha, because the sriracha pepper is a little different than cayenne pepper, so it has a little different effect on the body. But cayenne pepper has enough capsaicin that it actually will lower blood pressure.
Yeah, and I do take that regularly. Cayenne and everything.
It is
Turmeric.
perfect. Turmeric is a great anti-inflammatory.
Yeah.
And the more that we're able to do dietetically like that, and make sure you're combining black pepper with that turmeric,
Absolutely.
and that helps to bring the body to
Full
absorb
absorption.
it.
Yeah.
Yes.
Oh, yeah.
But as we're looking several years ago now, we are looking at inflammation in the gut. As we go towards the outer edges, there are some things environmentally that you may have been allergic to, but again, this is several years ago, and depending on where you were, what time of year this was,
Yeah.
there could have been some allergies. You could have been around some smoke.
Yeah.
It's not, I can't say, oh my gosh, we got to do something. This just gives us a better idea of what's going on. And now what's really interesting is that really dark edge
Yeah.
is telling me you have ingested heavy metals. And your body's trying to get rid of them, but it doesn't know how.
Oh my goodness.
And so as I look around that edge, and then as we come out here, you see those white two circles outside of that blood drop. That is evidence of a head injury.
Really?
You could have been rafting and thrown out of the raft. You could have been in a car accident and had some coup contra coup, a little bit of whiplash. And the coup contra coup is the brain and the skull rocking back and forth. And I say rocking, but violently hitting back and forth and being scraped along the inside edge of the cranium.
How many years you think this is?
This is looking at almost a decade.
Wow.
So there's something there, but
yeah, I have a history with some head injuries.
Okay.
But when I was younger, in my teens.
Yeah, and that could be it. And I don't know how old you are right now. I know it's on your blood, but it's that's not something I'm really. Oh, you're a 35-year-old male that has it.
Yes, you're not. Yeah. You're
that's good information, but that's not what I'm really focused on.
You're not here as doing psychic work necessarily.
No.
trying to appeal.
Now this last blood drop.
Okay.
As we get to it. This is back in your childhood, and as you said, and you just told me, you had some head injuries when you were a child.
Yeah.
I don't care if you were playing football, if you were snowboarding, or if you were throwing yourself off high cliffs to jump into lakes. There is a more evidence, and that's bright circle right there in the middle.
Yeah.
That is evidence of that head injury that you were just told me about. You've always had some inflammation throughout your body, and you see all those white dots all the way through this drop.
Yeah.
You are also fighting something digestively. Your body just is not absorbing whatever it is that you've been eating all of your life. What that is, I don't know. If you can figure it out, great.
Probably
if
pizza,
not,
man. That's the only thing. That's the one dietary thing.
But it could be. There's an awful lot of stuff that goes on pizza.
Yeah, that's true too.
And it could be the wheat. It could be the dairy.
Course.
It could be. It could be. But you know what?
Yeah.
This is in the past. Let's focus on what's going on today, right now, so we can figure out how to make you a better person, health-wise.
Yes. Now, about I'm going to say 6 or 7 months ago, I started intermittent fasting.
Okay.
So I only eat between noon and 8 p.m. And it's a hard stop. Like I'm very disciplined. I have not missed a day. And the reason why I did that was because I was thinking about my gut health. Yeah.
And I will say that intermittent fasting is very good for most people. There's one or two out there, just like anything.
Yeah.
The intermittent fasting just doesn't work for them.
Right.
If it's feels like it's working for you and you're able to maintain your weight, keep doing it. You feel great, I'm not going to jump up and down and say, don't do it. And the only reason I stopped here, that little upside down smile or the rainbow, that actually is a hair that's on the...
Okay.
That's nothing going on in your body.
Right. It's very frightful, yeah.
I know. That's why I always have to stop. But as we come back, this is again that first drop, because I like to look at that and we'll leave you with, be able to say, this is what we're looking at. And this is actually the lowest setting of objective.
Okay.
And so if we were to go a little higher, it gives us a little more detail.
Oh, wow. My goodness.
And you can see that C-reactive protein, and there's those two spots.
Yeah.
Yeah, there's a little bit of inflammation. Does that mean that you're going to die tomorrow? Not from what you're doing right now in your body. I can't tell you if you're going to die tomorrow or not, because that's outside of my purveyance. But that's looking, like I said, you can see as we get closer, just what those layers of blood are doing. We're real close to the center of this blood drop.
My goodness.
I'll actually come a little closer that way. And you can see those junctions that I was talking
Yeah.
about earlier. And like I said, when I see them as dark and as tight as I do right there, that is a good junction. There's a little bit of C-reactive protein around, but it's not bad.
Yeah.
And then as we go to the bottom, you can really
Incredible.
look at some of those junctions and say, ooh, do we need to be concerned with? And all this does is it helps open up more questions.
Yeah.
And then as we come back out, and that actually is an even better, the junctions out towards the edge are looking really, really good, as I was saying. And you can see those as we bring that up the screen. Where those issues are on the outside edge, that's on the right-hand side, and it gets really good. Then there's a little bit of C-reactive protein right in the middle there.
Yeah.
And then as we get into the gut, and then you see a little more of the pituitary adrenal thyroid complex needing a little bit of attention
Yeah.
on this other side. And then as I come up and into that vitamin ring, that's looking pretty good. Could be better. So I want to see this vitamin ring all the way around.
Oh.
That's actually, I can say it's really, really good. So
Okay.
you could have an addition of some vitamins and minerals. And first thing is a multivitamin that multivitamin that your body will absorb. There's a ton of them out there.
Yes.
There's a ton of different formulations. As a matter of fact, one of the worst supplements that I've ever found, Centrum.
Oh, really? I've heard that.
One of my patients came in and she was absorbing it. It's like, you're absorbing the Centrum, keep using it.
Yeah.
If it ain't broke, don't
Exactly.
fix it.
We're all built so differently.
Yes.
And just to that point, intermittent fasting for about 6 or 7 months now, but I have not been like dieting. I've been eating good food, whole foods, healthy foods, no supplementation,
Okay.
no protein, no multivitamin, nothing. And I just started taking my multivitamin this past week.
Okay,
What did we go?
and that's why it's kind of there, but not really. And again, as we can look down towards that second drop,
Because obviously there's nutrition, there's vitamins, there's minerals.
There is.
all the essentials in my diet. But yeah, I'm actually now getting to the point where I feel like I want to feed this vessel more.
Yes,
I want to
yeah.
get more of the good stuff,
and
more intentional.
right as you were starting to take that supplement, you can see that vitamin ring widen just a little bit. So
Yeah.
there was something that we ate this weekend that your body wasn't getting enough of the rest of that nutrition.
I was feeling that for the last month or two.
It's amazing though, isn't it?
It is.
You didn't even tell me any of that.
No. That's the fun of this.
And then you can see, as I look out here, you can see that edge on that left-hand side of that vitamin ring that you did at one time. This was several years ago now.
Well, even if
couple years ago.
even if it was a year ago, I was doing daily shakes, microgreens. I was going berserk.
Yeah, and those microgreens, those daily shakes, you were getting the vitamins that you were needing from those shakes.
Without a doubt.
Without a doubt.
I was feeling good back then too.
And now as I went to this other objective, I can see a couple things, those dark spots right there in the middle. That's looking at the more of the organs outside of your gut.
Okay.
And so I can see some signs
That's that darker circle right there in the middle?
No, not in the middle.
Oh.
That's actually, the dark circle in the middle is your
That's
gut.
my gut. Okay.
Yeah. As we go closer towards the outside edge, you can see some dark spots
Okay.
kind of randomly placed.
Okay.
That sometimes is an indication that there might be some inflammation in the heart muscle.
Really?
Yeah.
Ooh.
That was right then. That was about 10 years ago. So
Okay.
it doesn't mean there's anything going on. You're going to die of a heart attack. I can't see that from here.
Just my body was
Your
going
body
through
was
something.
reacting and trying to say, hey, I need some help over here.
Wow.
Help me, help me, help me. And again, as we go back, you have been dealing with systemic inflammation all of your life.
And are you seeing reduced inflammation as we go, or is it
Reduced
consistent?
Reduced inflammation, because let me come back. As we look at this first drop, I'm saying first as in longest
Most
taken
of the
ago.
distance, yeah.
You can see the amount of white dots and the color of the blood as a whole. That's that inflammation. Now, as we come back into a few years later, it's a little darker. So it's looking a little better, but there's still quite a bit of that systemic, the white dots all the way through, and then a little bit of the adrenal pituitary thyroid right around the edge. There's a little bit, but it's not
Yeah.
not something that we're going, oh my goodness gracious, we need to get you on.
Yeah. And is it about supplementation? Is it about limiting your diet and taking away certain things at a time just to see if you can find, or are you essentially going to run tests to see what you're allergic to at that point?
It's more of let's figure out what your diet is. Let's see what supplementation you need. And sometimes you need some more of the adaptogenic. In my office, I have supplements, glandulars, a freeze-dried, essentially what it is, freeze-dried thyroid, freeze-dried pituitary, so that we can say, let's take this capsule, put it into your system, and your body, if it needs something from that cow pituitary, it's going to grab the pituitary hormones for the anterior or posterior pituitary, and it will put them where your body needs them. With the thyroid, it will take that freeze-dried thyroid and put into your body the T3, T4 that your body needs, and it will absorb that as you put it into your mouth and it starts dissolving on the way to your stomach. It will actually start absorbing some of that.
Wild.
Absolutely amazing.
Yeah.
Then if you truly need the adrenal, again, and there are other supplements. If we have some male health issues, I've got some orchic testicles, bovine testicles that are freeze-dried.
Wow.
If you need the testosterone, well, that can help to encourage your testicles to give you and to excrete the amount of testosterone you need.
Excellent. Incredible.
And then you also have levels of estrogen, as all people do,
Absolutely.
men and women. Women should have more, although there's an awful lot of women that are estrogen dominant. They are producing too much estrogen and not enough progesterone. And so there's some other things like DHEA, which is the foundation of steroid hormones, testosterone, estrogen, the estradiol, progesterone, that you have enough of that DHEA as that foundation, then your body will start to produce enough of those hormones. Excuse me.
See. Wow. So this really informs your practice in every way.
Big picture, yes. And why we need this instead of that.
Yeah, absolutely. You wish you would see more of this actively out there. Again, it felt so out of this world. It felt mystical. It's like, wow, he's a blood reader. This is wild. I mean, it makes sense. It does make sense. And it's so fascinating. I want to know more. I want to know so much more.
And the cool thing is, the microscope that was originally produced was produced by Raymond Rife in the late 1940s, I believe.
Wow.
And he was showing results that Western medicine, specifically pharmaceutical companies, didn't like to see, because he was getting people healthy and well and off of their medications.
Man.
There is a time and a place in a very acute phase that someone will need some medication. In fact, I had someone come in that is on a statin right now. I don't like statins as far as I can spit, and I'm too much of a gentleman to spit here. Statins, if taken too much, actually cause what we are starting to call type 3 diabetes, which is the precursor to Alzheimer's, because your brain is made up of cholesterol. 75 to 85% cholesterol is your brain. So if you are losing mental acuity, many times your cholesterol is too low.
Man.
Statins do their job really well. They remove cholesterol.
Wow.
But they're also removing the cholesterol found in your brain.
That's horrifying.
Cholesterol is also the basis of those steroid hormones, DHEA, like I mentioned before, testosterone, estrogen, progesterone. If you don't have enough cholesterol in your blood, you're not going to make those
Wow.
hormones. Also, cholesterol is like a Band-Aid when it's in your blood. So the plaque that we have been afraid of for so long is really a Band-Aid that was put down over the vessel walls that have inflammation. The body doesn't know what it needs to do necessarily to get rid of that inflammation, so it lays down the Band-Aid.
Man.
Then it sees the Band-Aid and says, oh, that's still not good, let me lay down another one. And eventually that plaque is just the level of Band-Aids. Like if I cut myself right there, put a Band-Aid over, it's the level of Band-Aids filling up the vessel.
That's insane, Dr. Colby. Really.
And so as we work on that inflammation and we piece together that cut, for lack of a better term, that's on that vessel wall, that Band-Aid level goes away.
It reduces.
It reduces, and then you have clear blood vessels.
Incredible. So how many decades have we been chasing low cholesterol at our expense? Again, talk about like respect this vessel. I mean, it's intelligence. It's speaking to us all the time.
And why I call it WHOL-listic, holistic.
Love it. Yeah.
Because we're looking at the whole body.
Absolutely.
And even as we get a step slightly aside from the live and dried blood assessment, we also do mechanotherapy. So we're looking at the body and where the muscles are and how that pinky toe on the left foot is causing this right shoulder to raise.
Interesting.
So as we work on that left pinky, that'll pull this right shoulder down.
Wow.
And as we're doing that, then we can figure out why. And as we're working through, well, this is why your nervous system is overreacting here and why we need to do this.
Man. And that's a whole other tool set that you're utilizing down there, I'm assuming.
Absolutely.
I can't imagine what that even looks like.
Absolutely.
Do a follow-up sit down where you put me in the chair, whatever that process is.
Well, most of the time with mechanotherapy, I actually would have you on our massage table.
Oh, okay.
Because we're getting in, and depending on what's needed, you could be face up, face down, on your side, but we've got to figure out where the muscles are wanting to be so we can put the muscles where they need to be.
Wow. This is a whole other can of worms.
Oh my gosh, there's so much that we're able to do, and I haven't even gotten to your lab report.
That's what I was going to say. I'm looking at this report, and I'm dying. Is there anything that...
As we're looking at the lab report, I have in front of me a couple pages from your report that you can put on and show everybody what we're looking at.
Sure.
And this is actually, we're looking at, starting at page 15 of the report that I sent you.
And that's this one here? This is the same thing?
This is the same thing. And what you're looking at in different pieces, this is where it's looking at what your blood says is optimal levels, what is slightly high, what is slightly low, and what we need to be really concerned about.
Okay.
What I'm seeing and what I like to see, especially with you, and we're looking at page 16, all the green that you're seeing are the places that are good and in optimal levels. The yellow, first, the calcium was slightly high. TSH, like I said, that's slightly high. It's not an alarm phase, so that's saying, yeah, there could be, because of the TSH, the thyroid stimulating hormone, is high, there could be low thyroid hormone. It could be T3, it could be T4. I'm not sure, because that's not the big picture.
Okay.
Your estradiol is a little low, so that's saying, you could eat a little more soy.
Really?
Which is estrogenic in nature.
Absolutely. I've avoided it since I was a kid, because I was raised, I was a soy boy. And
a little bit of soy sauce.
Oh, okay. So, okay, interesting.
That will actually might help bring that up just a little bit.
Wow, okay.
Your hemoglobin is a little high, so you are kind of trying to fight something, and that's where the white blood cell levels being a little low, that's something to pay attention to. Mean corpuscular value is the other yellow one here, and that just means the size, mean size of the corpuscles, the size of the white blood cells.
Wow. Looking
again at page 15, your glucose, fasting glucose, is a little high at 89. Where I look at it, and where I differ from Western medicine, is if it's under 100, I'm happy.
Okay.
Below, because I've seen too many cases when it gets below 80, that people start going into hypoglycemic reaction,
okay.
and you don't have enough blood sugar for the body to operate.
I see.
Your hemoglobin A1C is great at 5.3. Your kidneys are coming great. The electrolytes, the CO2 is a little low. That means your body, there's a little bit of metabolic acidosis. You're eating a little too many things that have acid, coffee and things like that. And I know I love my coffee too.
Yeah.
I roast my own beans, so I understand that. That's why I say coffee is
I feel you
one.
there. I love coffee roasting. That's great. That's true.
Lemon juice will help to bring that up.
Bring it. Oh, lemon juice will. Okay.
Amazingly
And
enough.
reducing coffee, I'm assuming?
A little bit.
Okay. No, I've in the last few months, it's been predominantly black coffee and more of it. So,
Well, 1 to 2 cups of coffee, I'm not going to sniff at, and I'm not going to say, oh, stop that.
Yeah.
I do that too. If you're drinking 12 cups of coffee a day, that's too much.
Yeah.
We look at the metabolic, the anion gap.
Yeah, what's going on there?
It's fairly high, but it's not an alarm high.
It's not almost an alarm.
Almost an alarm. Almost.
High.
It's high.
Okay.
That's saying that you're not processing what you're eating as well as you could be.
Wow. Okay.
Now, looking at page 18, your protein levels are great. Minerals, your calcium is slightly high. And the calcium albumin proportion is good. But that's why it's like, well, why we're looking at it saying more, it's more of a metabolic acidosis than a respiratory acidosis or alkalosis of breathing in. Your oxygen seems to be fine. I don't have your pulse ox. I didn't take that today, but that could give us a better idea of, are you getting enough oxygen in your body?
And then curious, like you would think, like, I want more calcium. Like that's calcium is something I think about. Oh, I want healthy bones.
You want healthy
strong
bones. The muscles, as they contract, actually use calcium.
Wow.
As the ATP is used to cause muscle contraction, and they're pulling everything across, the calcium exchanges place with magnesium inside and outside the cell.
Okay.
That's all happening all the time. And so if your calcium levels are adequate, that's great. This one is saying your calcium levels are slightly high, so you are doing okay, and it's not something that we need to be really concerned about. Just maybe keep an eye on.
Okay.
In about 6 months, I'd maybe take another lab test just to see is the calcium levels leveling out. And then as we come down, your thyroid, because all was tested, and this was just a quick thing for the Men's Health to say, yeah, we've got some things we're looking at.
Yeah.
It's not the complete thing that I would order. And that's just fine. The TSH is a little high. So there could be some, because that thyroid stimulating hormone is high, there could be a deficiency in T3 or T4.
Okay.
Could be a reflection of this was taken before the 4th of July weekend.
Right.
So it could be some anticipation of what was coming up.
Yeah.
It's hard to really say. As we look at your hormones, the estradiol, like I said, was a little low.
Yeah.
A little more estrogen.
Cool.
The soy sauce.
Yeah. Give me an excuse
Tofu.
to go get some sushi, man.
There you go. A good place to go would be like Mongolian barbecue.
Oh, really?
And some of the tofu cubes that you're able to put into your meal, a little bit of that soy sauce, that'll help bring that up.
That's where our episode director and I go to the Mongolian barbecue down the street here, and it's damn good.
Perfect. And it's great, and the spices that they put in their sauces are actually really good.
Oh, good.
And then your red blood cell, hemoglobin is a little high, so that's saying, yeah, I'm trying to get more oxygen too. We're trying to make sure that we're fighting low, as you were saying, some low white blood cells, or we're fighting and trying to make sure, and that's where some of the red blood cells then are taking on that immune response and becoming more spiky and have the spike cells. The hemoglobin might be a little high, but the hematocrit is good at 45. And then we're back to the mean corpuscular value. RDW is the red blood cell width, and that's looking pretty good. White blood cells, and they were not breaking out what they're seeing of the neutrophils, basophils, eosinophils, and there's a proportion of each.
Oh, wow.
You want more neutrophils than you do eosinophils than you do the basophils.
That is a more robust test.
It is much more robust.
Nothing to do with what they're offering there.
And that was a quick, hey, we want to just so you can see, this is a quick snapshot. That's if I were really looking at, are you really sick at something? Well, let's look at how many neutrophils are in the blood.
Are
they normal? Are they high? Are they low?
I want to know those numbers next. I do. I'm curious.
But your overall white blood cells, they're within normal limits.
Good.
That's a good thing to see. The rest of the great big 33-page report that you have is breaking out. Here's what's high, here's what's low, here's what are in optimal positions. And then it will even give you an explanation a little later. Well, this is what the anion gap is looking at. If it's high, this is what we want to look at. If it's low, here's some things we want to see. And as we go through that report in some of the later pages, then that will actually say, you know, you might want to take a look at your thyroid, because we're looking at that thyroid stimulating hormone being just slightly high. That's an easier fix, and yeah, we can do that through supplementation if it is if your thyroid gland is a little low.
Yeah. This report is so robust. This is incredible.
And this is just the patient.
Yeah, I see.
And I can look at it through the practitioner report, which is another 20 pages, because then it will also say, hey, don't forget to look at, and as you order future exams and future lab tests, take a look at these things.
Yeah.
I can look at your vitamin D levels.
Okay.
And as you're looking at the page number 21 here, your thyroid probability of dysfunction is fairly high.
Yeah.
Just below that is your blood sugar regulation. That's also fairly high, and that's where the glucose and as I looked at this, I recorded this exam as you were fasting. You actually said you weren't fasting, so it'll throw off numbers just a little bit.
I see.
And that's okay. But again, that's where my own training says I'm going to look at this slightly differently than what the standard levels are.
I see. Okay.
And if it's under 100, I'm not really going to throw a fit.
Uh-huh.
But what's the other cool thing is we're flipping through this, you can see where your thyroid function is, how much it's out of place, your pH balance, and that's where the metabolic foods you're eating, acidosis, you're eating too many acid-containing foods. Yeah. Do you ever have acid reflux?
Not very often, no.
Okay. Acid reflux, for the most part, happens because the acid levels in your stomach are too low. So as a signal, the sphincter valve, at the top of your stomach opens up so that a little bit of acid leaks through to say, hey, feed me, give me some more acid in the stomach.
Oh, it's the opposite of what I thought it was.
Yes, It is the opposite of what most people think. A quick check to see if this truly is acidosis or alkalosis, that is high acid or low acid, is take a tablespoon of apple cider vinegar. Good stuff like the Bragg's apple cider vinegar.
Yes,
that's
indeed.
just what people seem to have. Has some good mother.
Yeah, love the mother
stuff at the bottom.
Yep.
You take that, shake it up, a tablespoon of that, and drink that straight.
Okay.
Or put it into water and drink that. And if it settles the acid reflux, your acid levels in your stomach are low.
Wow. Are low.
Are low.
And then at that point, you want to consume higher acidity.
Some more
lemon.
Yeah.
Lemon juice.
Lemon juice is actually alkalizing.
Oh, are you serious?
I'm serious. When it enters the body, it becomes alkalizing and will alkalize the body.
Man.
And so what many people will do is we'll take juice of half a lemon, a tablespoon of apple cider vinegar, and a little bit of honey, and mix that together, and 8 ounces of water, and then you get the best of 3 worlds.
Interesting.
And if it's local honey, then that will also help fight allergies.
Yep, some inflammation, get that lowered.
And all of that at the same time, the body's going to take what it needs and put it where it needs to go. And if you get too much, you'll pee it out.
Of course. See, here I was thinking, here I am simplifying my diet. That's what I've been doing. I'm simplifying my lifestyle.
Which is great.
As long as I have some kind of guidance as to what's changing.
That's the whole point here, and why some of the nutrition that I suggest is to say, well, here's some guidelines.
Yeah.
When you're in here, do this. And as long as you're within this limit, you're going to be fine. And some days, that beer and pizza that you go out with your buddies with, okay, every now and again, have fun.
Yeah. Yeah. I need that too.
When you start making that a daily occurrence, then your body's going to start needing a whole lot more stuff.
Mm-hmm.
Let's look at the whole picture.
I like that pace. I prefer that pace. I don't want the alarms. The alarm isn't going on.
There's 1 or 2 things that I will be alarmed at, but most of the time, not really. It takes a lot for me to become alarmed.
So would you say that this would be a traditional like first visit for you?
Yes.
This is how it would have gone if I'd come to your office?
Yes. From here, I
Incredible.
actually would look at things, and because of the electromagnetic energy still contained in your dried blood, I'm able to do muscle testing with that.
Wow.
But instead of traditional muscle testing, you getting out, oh, take this, because I have a plethora of ways I can go. What I use is a tiny little it's a weight, it's a pendulum, to say, okay, what does Cheyenne's body need? And the electromagnetic energy, or the chi, getting back to the traditional Chinese medicine, the chi that's contained in this blood will be there for the next couple days. So I can still take that and say, okay, do we need to be concerned with? Is there an active infection?
Wow.
Do we need a multivitamin? Which brand, since you said you just started taking it, is that working the best for you?
Yeah.
Yes, no, great. If it's working for you, take that.
Yeah. Yeah. And it's actually enjoyable. I'm enjoying this. I feel like I'm learning a lot about my own body and how I work.
That is, and that, which is a whole nother realm of explanation, is actually the base of naturopathic healthcare. We are here to be your teacher.
Yeah.
Let's teach you how to take care of your body the best way possible. I don't want to put you on a specific company's vitamin C for the rest of your life. You need a little bit right now, but homeostasis, going back to basic science education, is a realm between here. And if it's between those 2 points, that's homeostasis. And it's always going up and down, like our thermostats in the house.
Yes, indeed.
You turn it up, it's going to say, well, we want it up here. We turn it down, and it's going to be down here. And if it's below that signal point, it's going to kick the furnace on. And that's what we're saying, is like, let's keep it here so your furnace is operating at the peak efficiency.
Absolutely. Because that's how this thing was designed to work. Damn it.
Absolutely.
And then obviously, like your practice is right here in Eagle.
It is.
Eagle, Idaho.
It is.
Just down the street from me, which is great to know.
It is. We're at 150 East Aikens Road.
Excellent.
We're in the middle of changing our website up a little bit, but it still will be www.wearepressingmatters.com. And you can reach us. Our office number is 208-995-2891.
Well, I strongly encourage people to check this out because, again, when I saw it live, it was spellbinding. I was like, wow.
Spellbinding, and you had to pull your jaw up off the floor. I saw several of those.
Yes.
But now that I've got the two hours that we've just gone through this, and you're able to explain, this is what we're seeing, this is what could be. I can't tell you for sure, but let's look at.
Yeah. Dr. Colby, this has been amazing. Is there anything else you want to add to this at all?
There's an awful lot that
I know there is.
That we covered, and I know even with the time taken, it can be a fire hose of information.
It can be. But I have an appetite to go deeper, and I think a lot of people do too.
Yes, and
So this is
more
an
people
amazing
are regaining that appetite. One of the things that I actually wear with pride is I am a quack. I am a qualified user of age-old common knowledge.
Lovely.
QUACK.
That's a t-shirt, man. Absolutely. I love that. That's great. Dr. Colby, this has been amazing.
It's been a pleasure.
Thank you so much.